Hi again, everyone. Brian here, licensed massage therapist at Rasa Spa in Ithaca, New York. And I'm here to talk to you today about some foam roller techniques that you can use for the upper leg, which includes the quads, the hamstrings, the adductors, and we'll talk a little bit about the IT band on the outside of the leg as well. So first we'll talk a little bit about the structure of the area. The main bone that you have going through this area is the femur. It runs from the hip here all the way down to the middle of the leg here. There's a couple bony prominences on this leg that we'll talk about a little bit throughout the video, just as landmarks to help you know that you're working in the correct area. There's also the patella, or the kneecap here, that will basically just helps protect the knee joint during its flexion and extension. The main muscles that we're talking about in this video are the quads, which do primarily knee extension, like that. There's also one quad muscle that helps with with hip flexion, rather, which is this motion as opposed to this motion. And then you have the hamstrings on the back side of the leg. Their primary function is knee flexion. They also do hip extension, which is the opposite of hip flexion. Then you have the adductor muscles, which are on this inside portion of the leg. Their main function is to adduct the leg, which is to move it across your body. They also do a little bit of action on the hip too, but we're mainly going to be talking about the action that they do like so. And then you have the IT band, which is on the outside portion of the leg here. It's not a muscle, it's a band of really thick connective tissue that runs from this muscle here called the tensor fascia lata, which does do some hip flexion and does tense the IT band. The IT band itself is just connective tissue, it's not muscle. It runs over lots of muscles, and then it attaches down here at kind of this medial aspect of the shin, or the lateral aspect of the shin, rather. And it just gets really, really tight. I find that pretty much every client that I work on has issues with their IT band. So that's where we're going to be starting. So we'll take our foam roller and we'll lay it perpendicular to the way we're going to have our body. I like to start at the top, but you can certainly start it at the bottom of the area. And similar to how we were using the lacrosse ball in our previous video, we're just going to start by sinking in to the foam roller and creating a little bit of pressure. Being really mindful at first about the amount of pressure we're giving. And I found recently, as I was working with the foam roller on my legs, I had this tendency to kind of just grip it and rip it. Like I was just going back and forth, and I didn't realize how much tension I was creating in my leg by doing that. I was basically tensing my muscles in order to try to relax my muscles, which is a little bit counterproductive. So rather than that, I'm going to make sure my knee is a little bit bent. You don't have to have it that way. It just is a good kind of cue for your body to kind of relax the muscles in the front here, the quads. And then I just try to take a few breaths in this spot, really trying to relax my leg as much as possible. And then slowly, without then re-tensing, just kind of working down the portion of the leg. And this can be, if you're not used to working in this area, can be really intense. So go slowly, check in with yourself, and just take your time. So as you can see, I'm working back and forth across the muscle, underneath the IT band, accessing different angles here. You might see my back foot lifting off like this. I'm just really using this leg for stability I'm not really lessening the pressure, but certainly if this feels like a lot of pressure, you might want to put a little bit of weight through that leg in order to get to a level of pressure that feels a little bit more productive for what you're trying to get out of the session. So then just working all the way down, and then working, same concept, all the way back up, that outside portion of the thigh. And stopping along the way in any spots that seem like they need a little bit more attention. And then we talked a little bit before about the tensor fascia lata, the muscle that the IT band connects to in the hip here. And since we're working on the IT band anyway, the TFL is right next door. So we're just gonna, I'm on this little bony prominence on the femur here, and I'm just gonna pop over that, and there's this little kind of soft, meaty portion between the bone that's here and the bone that's more up here, the actual hip bone. And then that's where the TFL is. And you have some, your lateral glutes kind of next door, but in order to get the TFL, we're a little bit more on our stomach or prone for that particular thing. And moving the hips side to side to access that area a little bit before moving on. And since we're already kind of in this prone position, then we'll start working on the quads. And so it's kind of the same concept. I'm going to be, instead of going on that lateral portion of my leg, I'm just going to be working this way. And I'll actually work on my other leg a little bit, so it's a little bit easier for you to see kind of the angle of pressure that I'm using. So, and then it's the same concept, and you can incorporate some knee flexion in there. That's the opposite motion that the quads do. So it can provide just a little bit of different stimulus. You're essentially stretching that muscle out underneath the pressure. Certainly if you feel like you're getting enough pressure just with the direct contact, just stay in that spot. And think about, again, attacking a little bit of different angles. So right now I'm straight down on the quads. I'm on the muscle called the rectus femoris, which is kind of right in the middle on the top. But if I shift over a little bit, I'm more at like a 45-degree angle. And in this portion, I'm getting more of that vastus lateralis, which is on the outside of the quads. And that is really tight for me. But spending a moment there, and then moving over to the other portion to get the vastus medialis on more of the inside 45-degree angle of the quads. And then you can follow that up if you want by doing a simple quad stretch. And then releasing when you feel like you've adequately worked the area. Now we're going to move into working the adductors, which is the muscles on the medial portion of the leg. And this can be a little bit tricky to set up, but basically what we're going to do is this time we're going to put the foam roller more parallel with where our body is. And we're going to lay down next to it, and then we're going to put our leg out to the side like this. So then our body is parallel to the foam roller, but the leg that we're working on is still perpendicular. And then it's the same concept. You just roll up and down the length of the muscles. I'm doing a little bit of hip internal and external rotation, which you can see my foot going up and down there. And that, again, is creating this kind of seesawing back and forth across the muscle in areas where I feel it needs a little bit of extra work. working all the way up to the hip, spending a little bit of time there, and then coming all the way back down again, thinking about getting in those different angles, getting in more of that angle, or it's a little bit difficult to get in the posterior or the rear angle on the adductors from this position, but you can get a little bit of the edge of it if you just have your foot right on the floor. And then finally, we'll be talking about working the hamstrings in the forearm. So with the hamstrings, again, I like to start up where kind of the more hip portion is, right underneath the edge of your glutes. So spending a little bit of time on this upper portion. As you can see, again, doing a little bit of internal and external rotation at the hip to get a little bit of extra stimulus across those muscles. And it's just the same concept. Just rolling back and forth, taking your time, attacking different angles. For me, this outside lateral portion of the hamstring, you can kind of see a little bit of the edge of it right there. So then it comes down and attaches in this area. That for me is exceptionally tight. And I find this often quite tight on my clients. So definitely sense into that area, see how it feels for you. Taking our time, working all the way down, doing a little back and forth on this lower portion, moving over, getting the inside or medial portion, working all the way back up, and then while you're here, you can even work your glutes a little bit. You're in the area, might as well. But we'll get into the glutes more on a later video. Again, thanks for joining us today, talking about foam roller techniques on the thigh. My name's Brian, here at Rasa Spa in Ithaca, New York. Please join us again next week. I believe next week we will be doing techniques for the hip, core, and lower back, but we will touch base again soon. And thanks for joining us. Come back next week. Thanks.